In February this year, we launched Deloitte Health Connect in Basel. We invited our partners, our clients, and other colleagues into a conversation about the trends we saw accelerating, driving the future of health. We exchanged very personal views, at times even provocative views, about the trends we anticipated shaping the future of healthcare in the coming years. Now, only 6 weeks later, who could have imagined the world that we're in? COVID-19 has accelerated, in fact, disrupted many of the very trends we discussed that evening together. Lucien Engelen joins us again to discuss one of those trends, how moving healthcare out of the clinical setting is helping to reduce the burden on our healthcare systems.
If one of us, when we met back then in Basel, would told you that in a couple of weeks from then, the world almost totally would be in a lockdown, we probably would have called them nuts. And yet, here we are. In a world that almost in nothing resembles in the world that we've seen prior to that, we've seen images and videos from all over the world that we've never seen before. And although we were prepared, I think the virus has totally caught us by surprise. And one of the reasons for that is that we're hardwired to think linearly as opposed to exponentially. We thought the next day it would be a bit worse. But the reality was it was far worse than we thought. And the day after it was even worse. And in an exponential way, the virus created this epidemic that in the end of the day turned to be a pandemic. In this curve that we often see exemplified, we're talking about the peak for the ICU admissions that we needed to flatten, otherwise the healthcare sector would not be able to cope with it. And I think that's true, and it was very important to get that message straight. But the line that goes up front of it, the red line, which predicted that this was the max capacity of healthcare that we would not touch, the reality was that prior to this COVID pandemic, healthcare already was under pressure. And now, with all that postponed healthcare, in the end of the day, when all the workers have some relief from the ICU, once the curve indeed has flattened, we also know what happens. People will kick out of their adrenaline, and that's the moment in time when the ground kind of been kicked out underneath of their own experience. And they will need some extra relief. That is also the moment in time when the next curve occurs. The curve of all the postponed healthcare that also will be needed, those same workers that have been at the ICU ward as well. What we see now happening is also that new technology really is helping. Never before in healthcare, video conferencing webinars, almost sometimes on the hour, have been utilized as much as in the past 2 months. We've seen this happening not only in between healthcare professionals themselves, but for instance also between the professional and the patients, for instance. Where in a remote location when somebody is in self-isolation or even contaminated, we are able to linger with them and to ask them questions, of course. The reality of all of this is that I think we've been pregnant of digital health for years and years. And now all of a sudden, it has become a reality with a C-section. That is from one end to name good news. But will it last? Will it reside also once this pandemic has passed away? I think it should. I think we should be prepared for a new reality, a new normal, so to speak, where the reality should be a digital first, physical next strategy. And that's not to say that from now on we should be doing everything in a digital way, but we need to be prepared to do it digitally as well. And then it's up to the patient to make that choice, to make a choice whether or not they want to enroll it in a digital form. And the other thing that we see happening is that healthcare, when it comes out of this pandemic phase, will be more cross-industry than ever before. If one of the things this pandemic learned us, how crucial some of the sectors and also professions are. What would happen if we could combine the future of health indeed with the future of food, with the future of mobility, the future of work and also the future of finance, for instance. We see what the future of work kind of looked like in the past weeks when all of us had to work from home if we had that opportunity. I think the reality in the next couple of months, years maybe even, is that we have to get used to one or the other kind of lockdowns or intermediate steps for that. I don't think that this is going away anymore. We need new legislation, we need new reimbursement systems, and we need a different approach to the culture to utilize the technology that we've used because we had to, because there wasn't any other alternative, now also in that new normal becomes a reality and stays a reality. Because also for healthcare goes, if we need to start to deliver healthcare in the way we work and we worked.